Hello everyone, I am Divya Kiran from RPIIT campus Karnal. Today we are going to discuss about herb-drug interaction. Herbs are the plants or parts of the plants which are used to alleviate the diseases. Herbs have the holistic approach not only for the treatment of diseases but they also improve the health and maintains the well-being. So, in today's lecture, we are going to study about herb food and herb drug interaction. So, let's get started with the slides. Dear students, you know some of the very popular herbs like tulsi, aloe vera, black pepper. They are used for alleviating the diseases. You have heard that herbal drugs they have no or least side effects. But this is only true when you take them in a proper guidance and in a prescribed form. But if they are not taken properly and they are interacted with some of the drug or food, then they may cause serious effects to you. So, in this lecture, I'm going to tell you about the herbal drug interactions with the food and some diseases. Herbal drug interaction involves three types of interactions, which involves herbal drug interaction, herbal food interaction, and herbal disease interaction. In these interactions, herbs interact with the drugs. Either they increase the effect of the drug or decrease the effect of the drug on the body. They have unwanted side effects on the body. Herbal drug interactions modifies the pharmacological action of the drug on the body. So they must be taken with proper care and in the prescribed form only. Let's move with the herbal drug interaction. Herbal drug interaction is a very common type of drug interaction in which the herb interacts with the drug and causes ill effects on the body. If I give you example, then Vicodin is a painkiller, which when taken with the antihistamine drugs, which causes the sedation, like Benadryl, it produces drowsiness. And the drowsiness produced by the drug is in additive effect. So, Vicodin painkiller must be avoided with the antihistamine drug. The next is herb food interaction. In this, herbs should be avoided with food and beverages so that the effect produced by them must not be ill effect. For example, if a grape juice is taken with the anti-cholesteremic drugs, the drugs which lowers the cholesterol, then serious toxic effect is produced, like muscle pain and injuries in the muscles are produced. So the grape juice must be avoided with cholesterol lowering drugs. The next is our herb disease interaction. In this interaction, herbs should be avoided in some of the diseases. If we take the example of oral decongestants like pseudoephrines. Pseudoephedrines, these are added in the cough syrups. They remove the cough from the lungs. So these drugs increases the BP of the patient. So oral decongestants must be avoided for the patients which are having hypertension. They are dangerous combination for them. Here, I'm going to discuss some of the general guidelines by which herb drug or herb food interaction can be minimized. So just have a look on these. If you avoid mucilage containing herbs like isabgol, flex or other drugs, these are the drugs which produces bulk in our stomach and removes feces from the body. Like they help to prevent constipation. These drugs inhibit the absorption of many drugs. So they must be avoided if you are taking any kind of medications in your life. The another effect of these butylates containing herbs are these drugs alter the blood sugar level. So they must not be considered in the case of diabetic patients because it alters the blood sugar level and can affect the patients who have diabetes. The next effect is by the spicy substances, substances such as ginger, capsicum. These all herbs, they enhance the absorption rate of some drugs. So these drugs must be taken after the drug administration, after the 1 hour of taking your food, so that the absorption of the drugs must be maintained. Then caffeine, a very famous content which is present in green tea and coffee, they stimulates the effect of ephedra. Ephedra is a drug which is taken during the cough and it increases the heart effect, and it should not be taken during the antidepressant drugs and with the drugs which alters the mood. So these were some of the guidelines which help in minimizing the interactions. By these guidelines, we can cure some of the interactions produced by the drugs. Here are some of the drugs like ginkgo. It is a very common drug which is used in a cholesterol lowering drug. And this ginkgo is also useful in antihypertension and it is used in Alzheimer's diseases. But it has severe side effects if they are taken with some of the herbs like clove, garlic, ginger, or turmeric. The increased effect of dizziness, constipation occurs when they are taken with these drugs. The next interaction of the drug with the black pepper, which is very common known herb, black pepper we are using in our daily life, which consists of piperine, a main constituent, and it is used as antimicrobial and hepatoprotective. Moreover, it is used as hypercholesteremic. It has many pharmacological effects, but it has some of the interactions which is toxic to our body. If we take black pepper with turmeric, then it increases the bioavailability of curcumin. And if it is taken with some of the antacids, which are proton pump inhibitors, it decreases the action of antacids. And propranolol, it affects and increases the side effects of propranolol, which is used for cardiovascular system. So all these herbs, foods, and diseases, they must be taken into account while taking herbs as a medication. So dear viewers, I hope from today onwards you will be conscious and take your herbal drugs with the foods and with another drugs in a prescribed manner only. So that's all for today's lecture. Thank you everyone.